why it is also known as nervous colon. Okay. So I hope till now I'm like clear that it is basically a chronic gastrointestinal disorder which presents itself with a group of symptoms. Okay. Now moving further, first let's talk about a few facts, because uh, so talking about facts, it's basically a medically recognized disorder. So it is not just a group of symptoms, it is actually a medically recognized disorder, okay, which has its own line of treatment to manage the symptoms and everything. It affects 20% of your global population, and there is no single cause, there is no single test, and there is no single line of treatment. Okay. So there are different triggers, there are different factors which affects the flare up or onset of your IBS. So we cannot say because of this only your IBS is there, or this is only the line of treatment, or this way only you can diagnose IBS. It's not like that. Okay. Low food map for FODMAP diet is very effective. That I'll explain in detail later. Okay. Low FODMAP diet is very effective, and your treatments are available only to manage the sign and symptoms. You cannot cure IBS. Okay. You cannot completely cure IBS. Basically, it is to manage different sign and symptoms. Okay. Now, talking further, so as I said earlier also, that cause of IBS is unclear and is definitely not a single one. But there are certain factors and trigger which can flare up the onset of IBS. So let's learn that what can be those triggers. Okay, so moving on to the next slide. So there are certain factors like your diet, your mental health, your food allergies, your infection, your change in gut flora, right? Diet like food like chocolates, your alcohol, your milk, your caffeine, these are the foods which can trigger. If you already have IBS problem, it can trigger. Or if you don't have IBS, but you're consuming all these products for last 6 months, 1 year, 2 year, 5 years, it can lead to IBS problem itself. Okay. Mental health, if you are under a lot of stress since last 1 year, 2 years, 6 months, 3 months, so again it can either trigger the IBS or it can lead to the IBS onset also. Okay. Your emotional stress, that is one of the major effect on your gut. Stress has a major effect on your gut. I'll give you one example. Like when you go to give your viva, right, or when you go for your interview, what happens? Tension is in your brain, but the sound is coming from your gut, right? So definitely it has a direct impact on your gut. Okay. Intolerance to food, that means people who are allergic to certain food like your gluten, your lactose, right? So sometimes what happens, people are not able to understand that why this gastric or flatulence or this spasms are happening, right? Because they're already consuming gluten or lactose which their body is already intolerant to, right? So in long run what happens, it ultimately turns out to be IBS. Okay. Infections like maybe a typhoid or a gastroenteritis, right? In those kind of like if this infection is happening again and again, or a food poisoning and has is happening again and again, what happens? It weakens your digestive system, immune system, right? Because there is a immune system for your digestion also, right? So if there is a bacterial infection or a fungal infection or a food poisoning happening again and again to your digestive system, it actually weakens it, and ultimately it may lead to your IBS also. Okay. Gastrointestinal nerve function. So your gut is also called a second brain because it has a large amount of nerves around your intestine, okay, around your gut, right? So if there is any triggering factor which is sensitizing your nerves, that also can affect the flare up of your IBS. Okay. So these are certain causes. There are certain triggers also, like your depression, your stress, certain medications, long usage of antibiotics which kills the healthy gut bacteria also, that also can lead to the flare ups of your IBS. Okay. Anxiety, different infections, right? So all these can lead to your onset of flare ups or your onset of your IBS itself. Okay. Now there are certain risk factors also. your genetics. If you already have a family where they already have a weak digestion, or they already have a history of IBS, then it may come naturally to you, okay, because of your genetics, because of your family history. Gender, it is seen twice, females are twice at a risk of getting IBS than the males, because they are always on a hormonal up and down, right? And because of those hormonal up and down, there is a lot of emotional stress also related. So that's why females are prone to get IBS much more higher than the males, okay? And age also, because at the age of 40 plus, it is at a higher risk, because 40 plus, your digestive system starts getting weaker, your liver starts getting weaker, your gut flora starts becoming weaker. So all these factors can affect your IBS onset also. Okay, so this was about your causes and triggers. Now we'll come to the pathophysiology, that how it happens. Okay, but again, as I said, there is no certain cause, or there is no certain only one particular cause, or there is one kind of effect on your gut, right? So it is said that it may be a result of combination of your movement of your intestine, increased sensitivity of your nerves around your intestine, and disruption of your brain and your gut axis. That means there is a connection between your brain and gut. If that connection gets disrupted because of the triggers, so it can lead to your IBS. Okay, so we'll know further about it by watching a video. Justine, request you to play the video, please. It'll just give you an idea that actually what happens, okay, inside, what is happening under the inside the large intestine.
Irritable bowel syndrome, or IBS, is a chronic condition affecting your large intestine. Your large intestine, also known as your colon, includes the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anal canal. The muscular wall of your colon contracts in a rhythmic fashion called peristalsis to move the intestinal contents toward your rectum. As it contracts, your colon absorbs water and nutrients from partially digested food moving through it. Waste material, called stool, is stored in the rectum until it is expelled through the anus as a bowel movement. With IBS, the muscular contractions of your colon are abnormal. In some cases, the contractions may cause food to move too quickly through your colon. As a result, your colon does not have enough time to absorb most of the water from your food. This condition leads to a watery stool and diarrhea. In other cases, the contractions may cause food to move too slowly. As a result, your colon absorbs too much water from your food. This condition leads to a hardened stool and constipation. It is unclear why your colon contracts abnormally. However, if you have IBS, your colon may be more sensitive to certain factors such as stress that seem not to affect most people. Other symptoms of IBS include abdominal pain and discomfort, bloating, gas, and cramping. You can manage your IBS symptoms through a combination of dietary habit changes, stress management, and medications. Eating food high in fiber creates softer, bulkier stools, which may prevent spastic colon contractions. Fiber also helps relieve constipation. Stress management therapies, such as hypnotherapy and yoga, may help relieve your symptoms. Your doctor may prescribe medications to help manage your symptoms, such as anti-constipation drugs to help regulate your bowel movements, antispasmodic drugs to minimize muscle spasms and reduce pain, or sedatives and antidepressants to relieve anxiety and elevate your mood.
Thank you, Jasleen. So now we'll understand actually what is the pathophysiology through these slides also. So as I said that we have to understand that our gut is largely influenced by our brain and is irresponsible for the gut functionality. So on your left hand side, you will be able to see that brain basically influence the motility of your gut, the secretion, okay, the mucus secretion from your gut, nutrient delivery, that means the absorption of nutrients, and your microbial balance, okay. The same way, gut also gives a message to brain on your neurotransmitters, your stress and anxiety, your mood and behavior. So accordingly, this balance happens. Okay, so if your gut is having if your gut is having a lesser amount of the gut is not able to absorb a proper amount of nutrition, and also the brain will tell the gut to increase the nutrient absorption, or it will slow down the motility so that the absorption of nutrients happening, right? So basically your gut and brain are correlated and has to be balanced to manage the proper functionality of your gut, okay. And that's why it is also called a second brain, because it's having a huge enormous net of your nerves, okay. Now secondly, in the video also you understood that the person with IBS is basically having a very sensitive colon, right? That means it gets stimulated with a very normal stimulus also. The stimulus, the trigger, which is normal for other people, but it is not normal for the person having IBS. With that smallest possible trigger also, it basically starts in hyper reacting. It becomes sensitive and becomes hyper reactive than usual, and it actually responds strongly to the triggers, and it can work both ways from there. Like imagine you have a person who has IBS, which has a very sensitive colon. There is a certain trigger which affects that sensitivity. What happens, it either can go both ways. It can make it either hyperactive or it can make it sluggish. So when it is making it hyperactive, the IBS will be more towards your diarrhea side. If it is making sluggish, then the IBS will be more towards your constipated side. Okay, and that way it gives you different sign and symptoms. Okay, so first is your hypersensitive your colon. Okay, secondly, disruption in your brain and your gut axis. So because of these triggers, whether it's stress, right, when you're stressed, it actually the brain tells the intestine to increase the motility. Okay, so that's why stress also is again one of the major factors. Okay, thirdly, all these triggers stimulates the inflammatory and the immune response in the gut. On the right hand side, you will be able to see, because IBS is nothing. It's actually a situation of inflammation only, right? So these triggers basically stimulate the inflammatory response and the immune response in the gut. And what happens? So you are able to see, because of stress, because of your food, because of your bacterial product, what is happening? It is affecting the cell. It is secreting different inflammatory compounds. You can see histamine, you can see serotonin, you can see cytokines, right? And because of all these inflammatory compounds, what happens, it affects different way. So all these inflammatory compounds, it affects the nerves, which leads to your pain. You must have seen the people with IBS, they are having a lot of cramps and lot of pain. All these compounds also affect your smooth muscles, which affects the motility. That means it alters the motility. It either increases the movement of the intestine, otherwise it slows down the intestine. Okay, third, it also affects the permeability. Permeability, that means the absorption of the nutrients, right? The absorption of the nutrients also gets affected. And the last is it leads to your chronic inflammation, and further it leads to a chronic condition of your IBS. Okay, so hopefully I was able to make you understand that where the disruption happens. Firstly, the IBS person is having a hypersensitive colon, right? Secondly, there is a disruption between your gut and brain that is mainly related to your stress, okay? And thirdly, because of all these triggers, because of the food allergens and everything, what happens? There is a continuous inflammation happening in your gut, which is releasing a lot of toxic compounds, okay? Those toxic compounds is affecting your nerves, is affecting the motility of the intestine, it is affecting the absorption of the nutrients, and it is creating a chronic inflammatory condition leading to a chronic IBS, okay? So this was all about the pathophysiology of your IBS. Now moving on to the next slide, we'll understand that what are the sign and symptoms. Okay, they will never feel satisfied passing the